Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, February the 1st, 2021. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davila, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, good afternoon and thank you, Brad. Today marks the first day of Black History Month in Toronto. This is an important month for many of our residents. In fact, it's an important month for all Toronto residents as we continue to address some very serious issues in our city. In the immediate short term, we continue to manage the pandemic and in particular to address issues of equity and the extraordinary impact that COVID-19 has had on a number of communities within our city, including the Black community. In that regard, we will be bringing forward later this week a series of initiatives meant specifically to provide supports to the Black community in Toronto so as to help the members of that community to fight off the virus, its effects on them, and to try to address some of the root causes for the extraordinary impact on them, as well as addressing the issue of the vaccine soon to be made available to them. The Black History Month itself is a month spent celebrating and recognizing the many achievements of Black Torontonians and Canadians. The Black communities in our city have played a big role in building up the city and have created big moments in our city's history. We need to do a better job of acknowledging that and making sure people understand and know that. This month presents us with a learning opportunity, an opportunity to be better allies and demand for better. This past year has been a turning point in the fight against anti-Black racism. We have seen peaceful protests and people coming together to take a stand against racism in all of its forms. The fight against anti-Black racism is vital, now more than ever, as we continue to battle the ongoing pandemic, which has brought into even starker relief social inequities and social economic inequities within our city. These are impacting our Black residents disproportionately. This is unacceptable, and we need to do better. And we are working hard to address it. While this month is a time for us to celebrate, it's also a reminder of the work that we must do to eliminate anti-Black racism in our city and the hard work that lies ahead in continuing to create an equitable and inclusive city. Doing that requires the will and the determination that I can assure you that I have as mayor, shared with my council colleagues, and an unprecedented public consensus among the residents of our city. Beyond the will and the determination, we do have to better inform ourselves about the centuries-long Black history in Toronto. The good, which has consisted of pioneering and of achievement, and the bad, the racism, the inequities, and the opportunities denied. We need to have a greater awareness of all of it if we are to really move forward as a city. As with many other annual events and days of recognition over the past year, the city's had to find ways to celebrate Black History Month virtually. The city has created some great online content that can be viewed at any time by anyone. This year, to commemorate Black History Month, the city's Confronting Anti-Black Racism Unit will use their Twitter account to highlight the great work being done by some community-based agencies and groups that the city has partnered with to support the Black communities in need throughout this pandemic. The work of these community-based agencies and groups and others has been critical in helping the city to support some of its most vulnerable residents. We also have our newly launched Awakenings program, a series of art projects by Black, Indigenous, and artists of color within Toronto history museums. As well, late last year, Toronto Archives launched the Black History in Toronto webpage. The page highlights the history of Black communities, activists and leaders, service organizations, and much more. A listing of all of these events and how to access them is available at toronto.ca/blackhistory. Black History Month 2021 represents an opportunity to turn the grief and the frustration and the pain of 2020 into a sense of hope going forward. Hope that we can build on the resilience and the strength of Black Torontonians and inspire ourselves as people and as a city to be better allies in the fight against anti-Black racism, and in so doing, honor the history of Black Torontonians. I also had a meeting today with my colleagues, all of the mayors and regional chairs from the Greater Toronto and Hamilton area. A separate release has been issued in that regard, but I should just say that at that meeting we reiterated our call for simplified and expedited sick pay. It is a crucial tool in the fight against COVID-19. We asked for clarification with respect to the regulations as they relate to dog grooming, because there are inconsistencies that are arising in the region in that regard. We supported the recommendation coming from the Council of Medical Officers of Health with regard to the safe reopening of schools as soon as possible, and that these measures, of course, have to be put in place coincident with that reopening. And finally, the need for reopening planning. While we're not all the way where we need to be having a sound plan to be put in place to help us to reopen when the time comes. On Friday, another thing that we commended the governments of Canada and Government of Ontario for was the new travel restrictions that now have started to be implemented. I am, as Mayor of Toronto, fully in support of these restrictions, and I believe that these actions were not only necessary, but what we need to do right now as we battle COVID-19 and the variants. Those variants come to our country piggybacking on people, and then they can spread from there. The fewer people who arrive for now, the better the testing and quarantine arrangements are, then the better we will be able to manage the virus overall and to manage the variants. I want to thank the Government of Canada and the Government of Ontario for taking these additional actions to help stop the spread of COVID-19 and the variants. This is, once again, as much as we may not like it, short-term pain for a medium-term gain, and for that matter, pain avoidance. In short, these were the right things to do. Dr. Davila has made it clear that the variants of the virus are a real concern and require immediate attention. She'll address yet another example of how concerned we need to be about this in her remarks today. I have echoed her words for some time now. I have certainly seen throughout the pandemic that timely action has the most positive impact. We are making progress, and I am grateful as Mayor to our medical advisors, our healthcare workers, and individual Torontonians for the fact that we are making progress, because everybody's been a part of that. Together with the vaccines, these are reasons for hope. But let's put the progress and the hope into perspective. Thanks to these efforts made more recently, during the second lockdown, the Toronto 7-day average of new COVID cases has gone from 1,023 at its peak to 592 as of January the 28th. This is significant movement in the right direction, but let's remember, as recently as August of 2020, just a few months ago, that very same 7-day moving average was 15 in the City of Toronto. So we have come quite some distance in these past few weeks, but we simply have to stay the course to see this thing through. All of this will, I hope, remind people about the continued importance of following basic public health advice. Please stay home as much as possible. Please wear a mask. Please keep your distance from others. Please get tested if you have any symptoms, and please do not go to work sick. And please avoid gathering with people outside of your household. I did have a moment to comment this morning when I was watching television and saw the headlights coming down the Don Valley Parkway from the north into the city. And it did strike me to wonder, did all those people really have to come to work today? There are people who have to. But there are many other people who are supposed to have been asked by their employers not to come to work, and I hope people will remind themselves of that. And please stay home if you possibly can. And employers, please remind your employees they can and should stay home if they possibly can. I would now like to ask Dr. Davila to provide her report for today.
Thank you, Mayor Tory, and good afternoon. Today I'm reporting 961 cases of COVID-19. 397 people are in hospital, and 105 are in the ICU. I regret to tell you that 18 people have died. The case counts today are higher as a consequence of adjustments due to the transition to the Provincial Information System for Case and Contact Management, which we announced last week. The change will bring Toronto Public Health into the same data reporting system as all other public health units. That work began over the weekend and is advancing steadily. All our other activity is proceeding as usual. As I indicated last week, the full suite of data we typically provide will be reduced this week. Toronto Public Health will continue to provide the new cases over the previous day, as well as total cumulative cases, new hospitalizations since the previous day, ICU admissions, intubations, deaths since the previous day, and cumulative deaths. The data migration from one system to another is complete. We are now in the phase of quality controls, which may require adjustments to figures as that work is finalized. Also, today we have just issued a media release with regard to an outbreak in Toronto seeming to involve the B117 variant. The outbreak occurred at Belmont Meats, a meat production facility here in Toronto. Currently, there are 78 confirmed COVID-19 cases linked to this outbreak. Of these confirmed cases, 2 have screened positive for the B117 variant and will undergo further testing to confirm these are variants of concern and the type. Toronto Public Health has communicated to advise cases and contacts that the variant has been identified in this outbreak. COVID-19 variants have been with us throughout the pandemic. This is not to minimize the concerns about the 3 variants that have been talked about so much recently. What is believed about the known variants of concern now is that they are more transmissible, they may be able to make some people sicker, they may be able to reinfect people who've had COVID-19 and recovered, and finally, that the vaccines developed seem able to produce an immune response despite the variants, although sometimes at lower levels. We should make decisions for ourselves on this basis for our own self-protection. While variants in viruses do emerge regularly, with respect to COVID-19, modeling and declining case rates in other parts of the world suggests strategies that create distance and limit interaction are still successful, even where the variants are present. Certainly the trend in cases in Toronto says the measures we're taking are working, both the measures put in place by the province and the measures we take as individuals. The non-identifying cell phone data we are able to access demonstrates this. The figures we have for mid-January indicate 81% of device time at home. That's almost as high as last spring. That time at home, time apart, is exactly what we need to sustain the indicators we're seeing. It is good news, but the work is far from done. And as we see today, the stakes are high. We need to keep at it to minimize the risk we wind up back where we started. The Centre for Disease Modeling at York University shows that if transmission of COVID-19 increased by 20%, we would expect 3 times more cumulative deaths by May compared to the number if transmission stayed at the levels we saw last week. If transmission were to continue to decrease even more, we could expect to cut the total number of deaths almost in half. This underscores the importance of distance in every respect. To mutate, viruses have to replicate. To replicate, viruses need human cells. So our job is not to give it to them. More than ever, stay home and stay apart as much as you can. It's important we continue to see the recent decreases in case counts as a trend in the right direction, but not one to be taken for granted. One of the most important things we know is how variants occur and what we can do to limit the impact. Whatever you can do, however you can do it, distance, 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 in any form you can create it, from space between you and others to wearing a mask as much as possible. I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. Before I provide my formal update this afternoon, I'd like to extend our sincere condolences to the family, friends, and all those impacted by the terrible fire that claimed the lives of 4 Toronto residents on Friday morning on Gainsborough Road. This is an unspeakable tragedy that impacts each of us deeply. I'm very thankful that the injuries our firefighters sustained while working to rescue occupants and fight the fire were not life-threatening, and that we expect each to make a full recovery. Our thoughts are with the family, the community, as the investigation into the origin, cause, and circumstance continues. Our coordinated enforcement teams continue to work diligently to enforce the regulations relating to COVID-19. The City has taken formal enforcement action 2,110 times to date. This weekend, our enforcement officers continued to monitor compliance with the Reopening Ontario Act. As a result, 3 charges were laid and 10 notices were issued against the owners and operators of a video store and a restaurant. Our officers also proactively inspected 138 bars and restaurants, with 1 charge being laid, resulting in a 99% compliance rate. I want to thank the vast majority of residents and businesses who continue to help stop the spread of COVID-19 in our city by complying with the public health restrictions and regulations. Over the course of the weekend, 47 charges were laid as a result of the investigation of complaints relating to large gatherings on private property and in private residences. This weekend, Toronto Police also responded to protests and rallies and issued a total of 2 criminal code charges as a result. I'd like to extend my thanks to each of our enforcement officers who do their best to meet the challenges associated with COVID-19 regulations each day. Finally, I would like to bring an important safety concern to your attention this afternoon. Outdoor skating is a favorite Toronto pastime, but skating on natural and man-made bodies of water, such as ponds and stormwater ponds, is very dangerous and is therefore prohibited in Toronto, with the exception of on Grenadier Pond. Grenadier Pond is the only natural pond in Toronto where the City of Toronto tests the ice thickness. A flag at Grenadier Pond indicates when the pond is not safe for skating. When that is the case, a red flag is posted, alerting potential users to the dangers of thin ice. When the ice on Grenadier Pond may be used at your own risk, a yellow flag is posted. Currently, Grenadier Pond is unsafe for skating, and the corresponding red flag is posted. Other natural and man-made bodies of water are not safe for skating, hockey, sledding, or any form of recreational activity because the ice that forms on these bodies of water is unpredictable, unstable, and often dangerous. As temperatures fluctuate, pond water and ice levels also fluctuate and may become unstable. Salt runoff can also make the ice dangerous. Recently, 2 people have fallen through the ice at Grenadier Pond when it was deemed and posted as unsafe. Fortunately, our first responders were able to successfully rescue and assist both back to shore, where they were treated by paramedics. This is a successful outcome to an immediately life-threatening situation. We are also hearing reports of warning and danger signs on ponds being removed, which is extremely dangerous for any unsuspecting skaters. The city has more than 50 artificial ice rinks across the city where people can get out and skate safely. As someone who has been personally involved in numerous ice and water rescues over the years, I implore you to stay off unverified natural ice and stick to the safety of our network of artificial ice rinks. Thank you.
Thank you, Chief. Before we go to questions, just a reminder to reporters on the line to, excuse me, please unmute yourself before you ask your question. And we'll go first to Brian Passafume from the Toronto Sun. Brian, go ahead, please.
Good afternoon, everybody. First question is for Dr. Davila. In your opinion, what needs to happen in terms of numbers or trends for you to be comfortable with allowing Toronto schools to resume in-class learning?
Well, you know, Brian, there was a recent letter put out by the Council of Medical Officers of Health around the importance of school from the health perspective for children. And certainly, while there is concern around making sure that they are as safe as possible environments from a COVID-19 perspective, both for the students and for the staff, we recognize that there is a significant role that in-person learning plays in the overall health of children. Hence, there has been a real strong call on the part of the Council of Medical Officers of Health to really, as much as possible, aim for school reopening while at the same time creating as safe an environment as possible. And we know that one of the most important parts in terms of creating safe school environments from a COVID-19 perspective is actually reducing community spread. So to the extent that we are able to drop community spread of COVID-19 to the greatest extent possible, we know that that enhances the ability for schools to run as safely as possible. That's what it comes down to. Hence, it continues to be very important that we maintain the self-protection measures that we've all become so familiar with, because distance is the fundamental protection. It's the most important protection we have against COVID-19, while vaccine supply becomes more and more available.
Follow-up question, Brian? You have to unmute yourself there, Brian. Nope. Okay, if you do, just send us a private message. We can come back to you later. We'll go next. Oh, you're off mute. Okay, Brian, go ahead, please.
Yeah, sorry, the stupid WebEx kicked me out, but it seems to have brought me back. I'll have to check the YouTube for your response. Thank you so much for that, Dr. Davila. My second question is also for you. Over the weekend, we saw some troubling numbers in terms of overdose calls and deaths in the city. Do you fear that this is the start of another sad chapter in these lockdowns and the ongoing pandemic? And what needs to be done to ensure more people don't die needlessly of overdoses in the city?
So it is a terrible story to have had to put out there, that on Friday there were, a record number of calls for suspected opioid overdose. And we know that over the course of the pandemic, this has been a situation that unfortunately has gotten worse. And we know that there are many impacts that we need to think about on the longer term, as we ultimately emerge from the COVID-19 pandemic. Mental health challenges are certainly one of them, and substance use challenges represent another key element and a key problem that needs to be addressed on a go-forward basis. I think fundamentally when we look at what needs to be done, it's actually extremely well articulated in the Toronto Overdose Action Plan. A plan that has been endorsed by the Board of Health and really does draw on the science around what it takes to actually really reduce overdoses and to get at the core issues. So it does look at prevention, it looks at harm reduction, it looks at treatment, right? And it looks at policy. And fundamentally, I think as a society, what we need to do is consider this the health problem that it is, rather than looking at it solely from a justice or a law enforcement perspective. That has been borne out in many other jurisdictions. It's certainly supported by the available science on the issue. And it is something that we have been working on for the many years now at Toronto Public Health. We will continue to do that important work over the course of the pandemic. And I expect it will be something that will be on our work plan as we emerge out of the pandemic, and beyond.
Brad, I would just like to comment on that issue as follows. You know, Dr. Davila just said this was a health problem, and I know she meant it within the context I'm about to say it. It's not just a health problem. It is an urgent health crisis. You know, we have literally lost the weekend numbers, and the numbers from last week and the last couple of months are startling, they're disturbing, they're unacceptable, but they're following along on a pattern that has existed for some time now, where we've literally lost on an annual basis hundreds of Torontonians, just in Toronto alone, hundreds of people who've died from drug overdoses. And if you said to yourself, well, has the response provincially, especially from the provincial healthcare system, matched the scale of the tragedy, the answer is no. I mean, if we had this going on in any other area of health, or for that matter in any other area at all, we would be, looking to substantially invest in trying to have additional treatment programs and to support other elements of the overdose action plan that's been referred to. And yet we don't see that, unfortunately. And so I just think this is something where, the day of reckoning arrived a long time ago. And the health system, which is principally where this rests, this is not a question of morals. This is not a question of compliance with the law. This is a question of health, first and foremost, mental health and other kinds of health that have to do with substance use. And so I'm going to be talking on an increasing basis about this. I have been over the last number of months, but I think it's time to really step up the pressure here, because we need to have some action on this.
Thank you, Mayor. We'll go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. My first question is for Dr. Davila. Doctor, I noted in your list of the data that will be migrating over, you didn't mention variants of control. And I'm just wondering if that will, or concern rather, and if they will be included, and if not, why not? And if you could please just update us on the total number of VOCs now known in Toronto, and just finally with the Belmont Meats location, is that the first workplace outbreak that you know of that actually is involving variants?
So Matt, why don't there's several questions in one there, so I'll try to address all of them. So to my knowledge, this is the first workplace. And with respect to what data I provided a list of, what I was speaking of is, in fact, the data that we're going to be providing this week while we do this data quality check that needs to happen as a matter of having moved from one system to another large case and contact management system that the rest of the province is on. So we are moving over the data that we have in the previous system that we were using to support our case and contact management efforts into this large provincial database. And the list that I provided was simply the list of the kind of data that we are going to be updating you and the rest of the public on just for this week, recognizing that it's not as extensive as what we normally produce on a regular week, simply because we're making these important changes and data quality checks as part of the transition to the new system.
Okay, I apologize for fitting all that in there in that one question. I do have a follow-up for Mayor Tory, but just wondering what the total number of variants is before I actually do get this comment from Mayor Tory.
Sorry, Matt. So I would like to make sure that I'm giving you the right number. At last count, I believe it was about 14, but of course that number is constantly changing, and I'm happy to take that offline to give you the most current number. But I believe that was the last count that I saw from the province.
Okay, thank you for that. And Mayor Tory, just for one of my colleagues, Saul Corman, we learned over the weekend had passed away, and I'm just wondering if you could comment on the legacy that he leaves behind, and how you think that he will be remembered in Toronto's business community.
The legacy he leaves behind is called the Danforth. And the Danforth isn't just a place, it's a community. And I think he was one of the, kind of founding influences on that community. He brought people together, not just businesses, but he also then created the kind of environment in which we could have an event like the Taste of the Danforth, which I think attracts 1 million people a year. And there's a real community there. We saw that, at a tragic event like the Danforth shooting, that the people came together. And he is not the sole, reason for that, but he's one of the principal architects of that. And he made sure that community had a heart, too, in that he was behind many of the different fundraising endeavors they undertook as a community for the Michael Garron Hospital, for example. And he was a great sort of showman in his own way. I mean, he was an entrepreneur that made Corey's, clothiers for gentlemen, seem like it was a gigantic 12-story department store, just from the radio ads and the whole way that he built it up. And that's what you have to do to create dreams and to, to sell your community and to sell your own business. And he was terrific at that. So he was one of a kind, an inspiration, a cheerleader, a salesperson, an ambassador, and the Danforth will be a big part of his legacy, the Danforth as we know it today compared to what it was 25, 30, 40 years ago.
Okay, thank you for that. We'll go next to John Chidley-Hill at the Canadian Press. John, go ahead, please.
Good afternoon, everyone. My first question is for Dr. Davila. Dr. Davila, I was curious about the meat plant outbreak. For looking for the variant strains in that outbreak, would you be testing each case for all of the variants, or did you discover that there were the variants because of contact tracing?
So as I understand it, the variant strains were identified in 2 of the cases related to this outbreak, and that was done as part of the investigation. Again, the investigation proceeds as most public health investigations do by, understanding and being informed of particular cases, understanding the spread of disease within a particular setting, and then appropriate actions are taken. So we are still very much in the learning phase in respect of variants of concern. I think we are adapting our practices over time as we learn more and more about variants of concern and trying to target where we screen and where testing is actually done so that we're provided with the greatest value. Once you actually identify variants of concern associated with a particular outbreak, whether more testing is done often rests on whether it will change the public health management of the particular situation. So these are how things are done within the context of public health investigations. And of course, as we're continuing to learn about variants of concern, I expect you'll start to see practices change and be updated over time as we learn more and more about the variants of concerns and what specific measures can be taken to reduce their spread.
Mm-hmm. I also want to ask you, Dr. Davila, about the data migration. How helpful will it be going forward in terms of fighting the pandemic and maybe other public health issues to have Toronto Public Health and other public health units in Ontario using the same data management tools as the province? I imagine it would streamline things in some respect that you would understand that I don't.
Well, I think the proof is ultimately in the pudding, and we will be able to best determine the full benefit once we actually have the opportunity to be fully up and running on the new system, having gotten past this data quality stage that we're currently at. But certainly anything like referring cases from one jurisdiction to another, we know that many people in this province, live in a certain jurisdiction but work in another, or undertake activities in another part of the province. So it's helpful to have the relatively easy ability to refer cases and to refer information on an as-needed basis from one jurisdiction to the next. That certainly will be one of the benefits. Another benefit associated with this particular system that the province brought on board last year has to do with its ability to take in laboratory reports of COVID-19 tests on a regular basis, and it is a more seamless integration between the lab reporting and what goes into the public health information case and contact management system. So those are the kinds of benefits that we're hoping to appreciate more and more as we fully onboard onto this new system. So stay tuned.
Okay, thank you very much. We'll go next to Mark McAllister from City News. Mark?
Thank you very much. To Dr. Davila first, going to follow up, I guess, on a couple of questions from John. First and foremost, when you are investigating the new variants of concern, are you considering or are you already going about a different method of contact tracing? Are you going to be dedicating specific staff to do that separately from what you're already doing?
So, Mark, the way we have done these things in Toronto is in keeping with the guidance that's provided by Public Health Ontario. So what has been issued by Public Health Ontario is guidance in respect of managing variants of concern, premised on the best available science as we understand it. So there are new guidance documents in respect of case management, in respect of contact management, when to test and how to do it differently, different periods of quarantine. That kind of thing is all informed by the latest available science and is being done on a consistent basis in keeping with guidance put out by Public Health Ontario, which all of us as local public health units are using. I expect that this guidance will change over time. Again, these are new variants of concern, and the science is constantly developing and evolving, and our practices should develop and evolve in concert with our changing knowledge. So that is something that we're following the current guidance that's been put out there now, but I expect that it may change over time and that we'll change in accordance with it. As far as how we organize our work, we tend to have things organized here in Toronto Public Health premised on settings more so than on variants of concern or teams that are specifically dedicated towards that. And certainly we know that within the context of congregate settings, there is heightened concern around variants of concern, as you can appreciate. And so our teams working in those areas where we know we have outbreak teams or congregate setting teams, they are being especially vigilant, and we have communicated, of course, with a number of these settings to ensure that they're conducting appropriate reviews and audits and making sure that they're doing the best they can in respect of infection prevention and control, and really all aimed at that distance, and distance, which we know really makes a difference in respect of transmission.
So let me get your best advice, knowing that you will be following other guidance documents, but I'll ask you this anyway. When it comes to the variants of concern, does more need to be done in terms of practices at this point, beyond being more diligent with distancing and masks as is? Do we need more protection? Do we need different types of masks at this point?
Well, I think those are questions that are under active consideration at this point. I look at the guidance documents that have been put out by Public Health Ontario around what we can do at local public health on case and contact management, and we're certainly adjusting our practices to account for this new guidance and to reflect the best available science on the transmission of variants of concern. When it comes to these other issues, again, we are looking very much to our scientific advisor organizations. We look to Public Health Ontario, and I understand that this is something that they're actively considering, along with public health authorities all around the world, to determine what makes the best sense right now, given what we understand of the heightened transmissibility of these variants of concern. But at an individual level, for the public, what makes a difference, what we have seen makes a difference, whether we look at the experiences of other jurisdictions or whether we look at that which has been put forward in modeling studies. What we have seen makes a difference is really keeping your distance. So to the extent that people are able to really limit their actions, to stay home as much as possible, to really only go out for those essential activities, so as to avoid close contact with others to the greatest extent possible, this is what actually reduces the spread of COVID-19 and therefore reduces the impact of the variants of concern.
Okay, thank you. We'll go next to Francine Copen from the Toronto Star. Francine, go ahead, please.
Good afternoon. My first question is for Dr. Davila. Dr. Davila, earlier today, Ontario's Chief Medical Officer of Health said that he's hopeful that students will be able to return to class on February 10th. And he said that local medical officers of health will have a say in whether a given region does move ahead with reopening schools. So, Dr. Davila, what is your opinion on whether students should be returning to school on February 10th in Toronto?
So, Francine, like my colleagues around the province, as you can appreciate, I am very keen to see students get back to in-person learning at the earliest moment possible, but it has to be safe, right? We want to make sure that we are creating as safe as possible environments for our students and frankly for all the staff that are part of our school communities. You'll recall, and I mentioned earlier in an answer to an earlier question, that the Council of Medical Officers of Health is strongly behind the notion that schools should reopen as early as possible because there are very significant benefits to the health of children when it comes to in-person learning. And of course, we have to consider what measures can be put in place to create as safe an environment as possible in our schools from a COVID-19 perspective. And I can assure you that I have colleagues here at Toronto Public Health who have been in active conversations with our provincial counterparts and with other local public health units, particularly those in the GTHA, to ensure that we're working together in concert and seeking to provide all the benefits of in-person learning as early as possible, but in as safe a manner as is possible, given that we do have COVID-19 transmission in our community. I think the really important component here is that our experience has shown that what really drives risk within the school environment, outside of making sure that you've got all the appropriate infection prevention and control practices in place and are maximizing those to the extent that that's possible, what really all of us can do to support the ability for our children to return to in-person learning and get all those benefits that they get from those environments is to do our best to reduce community spread. I just can't say that enough. It is so important. The more we're able to stay home, the more we're able to keep distance, the lower the spread of the virus is in the community and the safer our schools are.
And my follow-up question is for Dr. Davila as well. Is the development of the variant, in particular the B117 variant, is that making a return to school on February 10th less likely in any way?
Well, I think the variant B117 and its increased transmissibility and the concerns that that gives rise to are cause for concern with respect to our ability to control spread, right? We know what works. But clearly what it tells us is that if we're dealing with a variant that is more transmissible, we need to be that much more vigilant around our practice of the self-protection measures. We need to be that much more vigilant around ensuring that we are maintaining our distance, that we are staying home as much as possible. But as borne out by the experiences of other jurisdictions and what we see in the modeling, the fact is that even where there are variants, if we maintain good control and really focus on self-protection measures and the other measures that are in place in order to keep distance and to limit interaction, both at the sort of policy level and at the individual level, we can, actually maintain control on this and continue to see declining trends even in the presence of variants. That's been the experience in other jurisdictions, so I know it's well within our control here.
Okay, thank you. We'll go next to Kate Allen from the Toronto Star. Kate?
Hi, thanks for taking my question. Or questions. They're both about variants of concern for Dr. Davila. I'm wondering about Public Health Ontario's point prevalence study, where they're screening all positive cases from January 20th across the province for the existence of variants. I'm wondering if you can tell us what that has shown for the presence of variants in Toronto or if final numbers aren't ready for that, if you could speak to trends.
So Kate, I think it's early at this point for me to be able to provide you with any information, and that might be a question that's actually better directed towards my colleagues at Public Health Ontario. But as I mentioned last week, I think that we need to consider that there is community spread of variants of concern. Certainly in Toronto, arguably throughout Southern Ontario, that has been what has been put forth by our colleagues at Public Health Ontario. And I expect may be borne out as the results from their point prevalence study become, publicized and promulgated. So again, what it tells us is that we need to continue to be very vigilant around self-protection measures, maintain the distance, because we know that these variants of concern are associated with increased transmissibility. And if we want to control the spread of the virus in our city and throughout the province, then we need to be extremely vigilant around the measures that we know work, and that comes down to distance, distance, and distance.
Okay, thanks. And you've already spoken to this a bit, but just to be a little more specific. So last week at the province's modeling update, we heard from the head of the provincial science table that we can still keep driving case numbers down with the increasing incidence of B117 as long as our reproductive number stays below 0.7, and the city is reporting a reproduction number of 0.8 right now. So I'm wondering how concerning that gap is to you, and if you think Toronto is ready for the rise of B117.
Kate, what I would say is that when we look at the experiences of other jurisdictions, when we look at modeling, including the modeling that has been done by the COVID-19 Science Advisory Table, we know that strategies that actually create distance, that help support creating distance, and strategies that limit interaction between people actually are still successful, even where there are variants circulating in those environments. So to my mind, the way I see it is that we have demonstrated over the course of the last few weeks, and we've demonstrated before in the pandemic here in Toronto, that we are able to maintain distance. So we know that when we put our minds to it, we are able to maintain that distance, and that when we do that, we actually see the corresponding decline in virus activity as manifest in case rates. This will continue to be incredibly important given the emergence of variants of concern. I suppose we're at that point in the pandemic where it really is incredibly important for people to maintain the discipline around staying at home as much as possible, because it does make a difference. We are beginning to see the positive effects of that, but now is not the time to relax or to take that success that we've had as of late for granted. We need to continue to stay the course, to really keep that distance, especially given what we understand of variants of concern. But recognize that there is hope. When we do this, we have no reason to believe that we won't have that experience as has been seen in other jurisdictions. As long as we keep good control, we can be successful in terms of controlling virus, even when variants of concern are present. But it's all about maintaining distance.
Thank you. We'll go next to Mike Walker from CTV News. Mike, go ahead.
Good afternoon, and thank you for taking my questions. My first question is for Dr. Davila. Back to the schools. Specifically, do you support a February 10th return date, and what factors, measures would you like to see specifically in place that would make you comfortable with suggesting that schools in Toronto can reopen?
So I think, we are in the process of having important discussions with our provincial counterparts. And of course, we're keen to see our children back at school. As I've mentioned several times, there are so many benefits to in-person learning for our children that as soon as we can get our children back to school in a safe manner, in a manner that actually supports their safety and the safety of their teachers and all those that are required to run our schools. That's what we're looking for. We're having active conversations around what enhancements might already be, or what enhancements might be put forward to help promote an even safer environment. I can tell you that the team at Toronto Public Health has worked very hard over the course of the fall, and they continue to work even as schools continue to be in their online format on the many services and elements that can be put into play in order to enhance that safe environment. So I would ask that you stay tuned. This is a conversation that is ongoing, and we're very, very keen to work with our provincial counterparts and with our other local GTHA public health unit counterparts to make sure that we're working towards that safe environment as quickly as possible.
Okay, thank you. My second question is for both Dr. Davila and Mayor Tory. The city saw a dramatic spike in overdose fatalities, an issue that's been exacerbated by the pandemic. Is there anything more the city can and should do now in the immediate future to deal with this issue? And do either of you support calls for safe supply and decriminalization that are coming from many, including the chair of the Toronto Board of Health?
Would you like me to start? So I'll start off with that. I think there are a number of things that we can do, and frankly that we have done, given the terrible circumstances that have arisen. But as the mayor rightfully points out, and as I have spoken about on many, many occasions prior to the COVID-19 pandemic, this is a significant health issue that impacts so many people in our city and has impacted so many people in our city for a number of years now. And I think that it is really important that people recognize that when we're talking about opioid overdose-related deaths, these are, preventable. And I think that's what makes them so terribly tragic, that they are indeed preventable and that they tend to happen to people when they're at the prime of their life, when they should be at the prime of their life. So this is a significant concern for all of us as Torontonians. And it's something that we have certainly been focused on at Toronto Public Health for a number of years now. And yes, the pandemic has certainly shone a light on it and has exacerbated some of the problems that were there, that have been there for a number of years now. So what we have done is that we have worked very hard with our partners to create, harm reduction services, to ensure and to expand the access to harm reduction services to the greatest extent possible. We have worked very hard, even within the constraints of physical distancing needs, to continue to provide supervised consumption services. And we have worked hard with our other partners who are engaged in safe supply type programs. So clearly from my perspective as the medical officer of health, looking at this as a public health issue, as a health issue, and looking at the science, the evidence around what makes a difference, it is clear, right? There is no question that I support issues like safe supply or programs like safe supply programs or safer supply programs as part of a strategy in order to address what we're seeing right now in respect of opioid overdoses in our city. We have also been very clear that taking a more health-focused approach rather than one that is focused on enforcement or criminal justice would be far more productive and arguably would save our entire system money as well, over and above being, frankly, just the right thing to do from an evidence perspective. So with that, I'll hand it over to the mayor.
Well, I'll simply say this. When we are confronted by somebody who has a problem with their heart or their lungs, our first inclination is quite properly not to pass judgment or not to try and sort of figure out if there's some moral lesson to be learned or not to contact law enforcement. It is to decide on treatment that we can offer to people to help them with that illness. And I certainly have watched with interest the pronouncements of the police chiefs from across Canada who themselves say it's not a matter of law enforcement as much anymore as it is, quite properly, a health matter. And so if there was the number one thing that I think we could all be doing, and I think it principally has to come from the healthcare system, which is a provincial responsibility, it is more treatment programs. We literally have outreach workers, which is properly our responsibility, that we have trying to help people, say outside of a supervised injection facility, to convince them to go to a treatment program. And it takes hard work to do that and a lot of professional expertise. And lo and behold, when you have those successes and people say, yes, I'm ready to go, we find that there are no treatment programs. How could that be? Because some of those very same people are the ones that then end up in one of these reports that they died from an overdose. And as Dr. Davila said, it's a preventable death. Hundreds of them happening every year in a big city like this. So I think it starts, there's a whole bunch of elements we've discussed today, but I think it starts with a lot more treatment programs and a different perspective that we take on this from what has been historically the case.
We'll go next to Jennifer Zhu from CCTV Medium. Jennifer, go ahead, please. You need to unmute, Jennifer. Jennifer Zhu, do you have a question? There you go.
Hi. I think all my answer has been answered.
Okay, then. Thank you very much. Finally, last question, certainly not least, to Lucas Meyer from News Talk 1010. Lucas, go ahead.
Thanks, Brad.
You're welcome.
Dr. Davila, you've touched on a number of questions from my colleagues on schools. So I'll kind of ask this one in this way. Kate mentioned the RT number at 0.8 right now. If you look at Toronto's trends right now, looking at the 7-day average, and let's just say, hypothetically speaking, that they stay consistent for the next 9 days, to get to this February 10th. If we see the trends stay the exact same way, in your mind, once we reach February 10th, will those numbers be enough to open schools safely?
Lucas, I think you ask a very interesting question. I'll start off with this first. Look, we have seen decreasing case counts and incidence rates over the last few weeks, thanks to the efforts of everybody in the city. My sincere hope is that we continue to see that. Right? I think first and foremost, we should not be contenting ourselves with staying at the same rate. I think we need to really be very disciplined about what we can do together as a city to really drive down the spread of COVID-19. There's no question that we can do this. We've done it before. We've just done it recently. We've done it before in the spring, I mean to say. We've done it in the last few weeks. And my sense is that if we continue to stay the course, to really focus on what we can do, each of us now, to really limit our interactions, we should be able to drive the case count down. And when we do that, it gives us that opportunity to be able to see our children get back to in-person learning, which we know is so beneficial to them, but in a way that actually heightens the safety of that environment for them and for all those around them, all the teachers and all the staff that are necessary in order to create good environments at school. So this is really what I think it comes down to. So, my key message out there to all Torontonians is to please stay home as much as possible. Really limit your interactions. Maintain your distance to the greatest extent possible. We are so close. There's lots of hope. Lots of hope. We know it works. And knowing what we know of our circumstances, knowing what we know about variants of concern, we know that we can do this, that if we really keep that distance, that not only will we be able to support our children to get back to in-person learning safely, but frankly, the sooner we will see the end of this pandemic and perhaps the resumption of something a little bit more like life as we used to know it.
Right. So I guess even just a simpler term, because you talked about our current course that we're on right now. Just to go back again to what I was saying before, again, is the current course, in your mind, if it were to just completely go as expected, enough to get back to class, or do you think we do have to do a bit more, or see case counts go down and those other factors go down a bit more?
So I'm hopeful to see our children get back to school. I would, of course, like to see our case counts go down. I do think we need to continue that, to have that vigilance and to have that discipline around maintaining distance to the greatest extent possible, everywhere and anywhere we can.
All right, thank you very much for joining us. That concludes today's briefing. Our next update will be this Wednesday, February the 3rd. Stay well, everybody.